Welcome everybody. Today we will be discussing inpatient management using Aasaan ERP. By the end of this video, you will know managing patients, admission, managing. Welcome everybody. Today we will be discussing inpatient management using Aasaan ERP. By the end of this video, you will know managing patient admission, managing inpatient treatment, managing inpatient medications, and discharge. Healthcare practitioners will assess the severity of symptoms and condition during the patient encounter and determine if hospitalization is required. Some patients are asked to admit to the hospital so that the treatment is provided by trained professionals. The admission, treatment, and discharge cycle generates a lot of data that needs to be captured and maintained. Asan ERP will show the availability status of healthcare using like beds, operation theater, and intensive care unit. During the treatment, healthcare practitioners routinely check patients and determine medications to be administered and further lab tests to be done. Also, it is important that all healthcare services provided to the patient are billed before the discharge. Asan ERP makes it easy to automatically send follow-ups after the discharge via SMS and email alerts. Let's see inpatient management in action in Asan ERP. For the admission of a patient, we need to create an inpatient record. We can navigate to the inpatient record under the inpatient menu, that is under the healthcare domain. Here we can create a new record by clicking on the add button. First, select the name of the patient. This will automatically populate the basic details regarding the patient. The admission status, the date and time needs to be selected. Next, select the medical department that will be overlooking the patient, the admission service unit type, the primary healthcare practitioner, and the secondary healthcare practitioner if applicable, as well as if there is any notes that can be written down over here. Moving on, we can even add nursing tasks that will be applicable while the patient is being treated, along with the expected number of days that the patient will be admitted. As part of the admission order, the practitioner can provide necessary details as to which type of ward bed the patient needs to be admitted to and other admission instructions for the staff on ordering a patient for admission. The Asan ERP Healthcare creates an inpatient record for the patient with all the instructions provided by the practitioner. Here we can enter what are the complaints from the patient, what are the diagnoses, what are the medications required, what are the investigations to be done, what are the procedures to be followed, and what are the therapy or the rehabilitation required for the patient. Once a patient is admitted to the hospital, some medications need to be provided according to the prescribed schedule. An inpatient medication order is created to prescribe the medications like the drug, the doses, etc. Let's navigate to the inpatient medication order, which is available under the inpatient menu. Click on inpatient medication order and select the patient. Here we can select the healthcare practitioner, set the start date of the order. The schedule for the prescribed drugs will be created starting from the date. In the medication orders table, there we will click the add button, and here we will enter the details of all the drugs, the dosage, what is the dosage form, from which period to what period, and with all the instructions, the details will be added. Order entries are marked as completed when an inpatient medication entry is created against that medication order. It can be done from the inpatient medication entry module present in the system. Finally, when the patient has defeated the disease and is ready for discharge, a practitioner can order an inpatient discharge through a patient encounter or the inpatient record. The discharge order allows us to select the content of the discharge notes, which will get updated in the patient's inpatient record document. We can select the investigations, medications, and procedures included in the patient's treatment at the facility, which is to be given as the discharge notes to the patients in print. Further in the ERP, we can also track the data and manage the data of various tasks performed by the nurses in the healthcare unit. So to track and record the nursing task, we have this nursing module under the healthcare domain. Over here, we can create nursing checklist templates where we can predefine the activities that will be performed by specific nurses to treat a patient. Here we will give a title to the template, then under which medical department it comes under, then what are the activities to be performed, is it a mandatory task, what is the type of task, is it pre-operation or post-op, what is the time of set, the task duration, and against which document. So once the nursing checklist template is created, now the nurses can log in into the system and create records against each task they perform daily. So they will choose like the date they have performed the task, who is the user or the nurse who has an account created in the ERP, under which service unit they were exercising the nursing task, under which medical department, and what is the status. Here they can select which healthcare activity they have done. Was it a mandatory one? Then who's who was the patient under which they have performed the task, and all the task schedule and the task resolution details they can enter in the nursing task.